third morphological variation that you see in a maxillary lateral incisor is the talon's cusp. Now, talon is the name given to the fifth nail of an eagle. So, an eagle's paw shows this extra nail on the inner aspect. And similarly, lateral incisors many times show highly developed tubercle in place of a cingulum. So, the cingulum is replaced by this extra protuberance of enamel. Now, this protuberance, because it is so well developed, sometimes it will also have a pulp horn in it. And if this protuberance develops a caries between the protuberance and the lingual fossa, then you can have again the pulp getting involved very early. Now, do you see why you need to know the pulpal morphology and how you can comfortably analyze how the morphology must be by just looking at the shape of the tooth. So, moving ahead with the pulpal morphology of the maxillary canine. The maxillary canine also has one crown and one root. So, similarly, it has one pulp chamber and one root canal. The difference between the pulp chamber of a canine and an incisor is that the canine is the widest tooth buccolingually. So, the pulp chamber also becomes the widest buccolingually amongst the central, lateral and canine. The pulp horn is one, it is quite prominent and it is more seen on the incisal third. The root canal generally tends to be widest in the cervical third area and then will gradually taper as you go to the apex. The canine also sometimes show a distal inclination of the root apex. In that case, the pulp chamber will also have a distal inclination. The maxillary first premolar. So, the permanent maxillary premolar has two crowns and two roots. So, similarly, the pulpal morphology will have two pulp horns and two root canals. The pulp horn is in the form of two horns each in one cusp. So, you have the buccal cusp and the palatal cusp both having one pulp horn. The buccal cusp or the buccal pulp horn tends to extend more incisally as compared to the palatal one, meaning the buccal horn is going to be higher up into the cusp as compared to the palatal. The palatal cusp definitely is smaller than the buccal cusp also. So, that is why the pulp horn also is there at a lower level. The pulp chamber appears to be squarish and the pulp chamber has its roof coronal to the cervical line. So, when you look at the crown of the tooth where the cervical line is located, slightly below it, because it is a maxillary tooth. So, the pulpal roof or the roof of the pulp cavity will be slightly more coronal to the cervical line. The pulp chamber is more rectangular in its dimension. It has a cervico-incisal length equivalent to the area of the furcation. At the furcation area, the pulp chamber will divide into two root canals. The root canals are one buccal and one palatal. Moving on to the maxillary second premolar. Again, this has one root and one root canal. The pulp chamber is broader buccolingually and is quite similar to the first premolar. The cross section of the pulp chamber at the cervical margin is more oval. The chamber in the maxillary first premolar was more squarish. This tends to be more oval. The reason being because the maxillary second premolar many times has only one single root, but this single root can still have two root canals many of the times. The pulp horns are usually going to be two because of the two cusps and they are of equal height. The maxillary first permanent molar has a crown which shows the presence of four well developed cusps and three roots. Out of these three roots, two roots are buccal and one root is palatal. So, similarly, the pulpal morphology also will have a pulp chamber that is more rectangular in shape and three root canals. The mesiobuccal root canal, the distobuccal root canal and the palatal root canal. But the mesiobuccal root canal many times has two canals which we call as MB1 and MB2. Hence, as the tooth has four cusps, so similarly pulp horns are usually four in number. The root canals have a triangular morphology and the palatal canal is always the largest, followed by the mesiobuccal and then the distobuccal. amongst the two mesiobuccal, that is the MB1 and the MB2, the MB2 tends to be more thinner and more ribbon shaped as compared to the MB1.